Hello, namaste all. I welcome you all to the 74th episode of GURUBODHA series of easyayurveda.com. I welcome you all to this session. Class session is brought to you by easyayurveda.com. I dedicate this and all of my works to the holy feet of Dr. A. Chandrasekhar Udupa. This class is made live, available exclusively for Easy Ayurveda subscribers, Easy Ayurveda weekly class subscribers. If you haven't already, please go to easyayurveda.com/video-classes. You'll get more than 400 hours of Ayurveda study material, videos, notes, audio files, everything. Along with that, you will be made part of our, Easy Ayurveda student community. We also are coming up with many easy Ayurveda courses on diabetes, heart disease, prakriti, herbology, pharmaceutics, etc. To gain access to all this, please go to easyayurveda.com/course. And this session is conducted by Dr. Rajinikanth Patel. He's an Ayurveda physician and practices and gained fame worldwide. And his hospital is Agnivesh Ayurveda Hospital, Surat, where patients can be joined and students can also go there for training and whatnot. And Dr. Rajinikanth Patel can also be consulted online for patient case-to-case basis guidance, and also for consultation directly to the patients or clients. Please go to easyayurveda.com/Patel, Patel. There you can pay fees and consult him.
Thank you, Hebbar sir. So, use of Suvarna Kalpa in clinical practice. What Ayurveda says about gold in when we think about using it as a medicine for any disease. So here I have kept one statue of Lord. As we all know, in India has a history of a rich temple. The metal in the temple we found is more is gold. There is two things in Ayurveda which is being told as auspicious. One is gold and another one is curd. So these two things, simply keeping in our home or simply by seeing these two things, we get the auspiciousness. So this might be the reason that all the ancient Hindu in India, which contains lots of gold, in the form of ornaments and in the form of statue. So one thing I put pressure more is that thousands of years of human observation and trial and error is far more better than 6 months of rate experience in the lab. What I mean here is we should respect our Samhita and Shastra. It is not written by observing just 100 rabbits or 100 rats in the laboratory and they have written down some conclusion. It is the observational work of more than thousands of work on human beings, and then our Acharya has written all this principle. So without any doubt, we have to respect and our Samhita and the Shastra. Okay, so for everyone, question must come that why should we use Suvarna when there is so many medicine? Why should we use Suvarna? It is faulty. So if we read Anand Prakash saying that if we are treating any patient and if we are doing all the procedure, for example, we are doing Panchkarma, we are giving Chaman Chikitsa, Shodhan Chikitsa, still in some case we don't get the results. For example, if Vat patient come or neurological disorder patient come to us, we are doing Basti, Vaman, Virejan, we are giving oral medicine, Kukulu, everything. But still we are not getting the results in some of the case, and everybody has experienced this thing. So in that case, we have to use Suvarna, and we have a reference from Anand Prakasha. So by using all kind of medicine and also doing Panchkarma, if Vyadhi or disease is not showing significant improvement, then Suvarna should be used. It must be used. Suvarna is also better than Shilajatu, Suvarna Makshik, Para than all type of Rasayana. So we can understand how important role of gold in terms of disease management. When you fail everything, when every medicine fails, role of Suvarna comes. This is from Anand Prakash. In detail, Lakshana and Guna of this Suvarna has been explained in Rasa Jal Nidhi. Snigdha Medyam Vishgadharam Brumhanam Vrishyam Agrayam Yakshma Unmat Prashamanam Param Deharok Pramati Medha Smriti Sukhakaram Sarva Dosha Amayagnam Ruchyam Dipi Prashamanti Rujam Swadu Paka Suvarnam Suvarna Chittalam Vrishyam Balyam Guru Rasayanam Swadu Tiktakacham Tuvaram Pakecha Swadu Pichilam Pavitram Cha Brumhanam Netriya Metta Smriti Pradhanam Radyam Ayushakaram Kanti Vak Vishuddhi Sthiratva Kuru. Here you see Vak Shuddhi. Vak Shuddhi means it makes the speech clearer. In the pediatric patient, when we see there is three disease mentioned by Sushruta, Muk, Gadgad and Munmin. This is the speech disorder, slurred speech or whatever you take. In this also it has a role. And Sthiratva Krut. Sthiratva Krut means, for example, Talaguna of Vayu is increasing. When you see Parkinsonism, or where the tremors Kampvat is there. In that condition or anywhere where Jal Guna of Vayu is increased, there we need Sthiratva. So Sthiratva Krut. Visha Udmada Tridosha Jara Sositam. Important to note here that slok starts with Vish Gadaharam and slok ends with Visha. So my main focus of use of gold in health will be Vish, anti-toxic drug. Okay, so we read Bhuta Avesha in this Rasajal Nidhi Shloka reference. In wherever the condition Bhuta Avesha is there, we have to use Suvarna. So what we should take here as Bhuta Avesha? Bhut can be taken as bacteria, either it can be taken as fungus or virus or any kind of sepsis or septicemia. When we read Charak Samhita Chikitsa Sthana, Rajyakshma Chikitsa, there Acharya Charaka has given a wonderful explanation about Bhuta, how Bhuta should look like. There he has told it has 16 leg, 8 head, round like that. So that may be compared to COVID virus. When you see coronavirus under the microscope, what Charaka has given explanation in this Rajyakshma Chikitsa, you can see. So this is the Bhut. Bhut is nothing something called means Bhutatma like that. It is a bacteria, fungus, virus, or any sepsis you may take. So any infection here it proves that gold has a greater role to play in management of infection. Let it be bacterial, fungal, viral, or sepsis. So there is one Gujarati book written by this famous author of name I forgot. This is exclusively written on Ras Shastra, Ras Prakash Sudhakar. There it has mentioned that this plasma prepared out of Swarna cures all the disease caused by the vitiation of the three dosha. And another importance is given that if any person consume this Suvarna Bhasma for 20 years, he will not be affected by old age. Means he will remain the youngs. And next line Shloka says the person who consume Suvarna or gold for 20 years, his body will not be affected by any kind of poison. Let it be artificial poison, chemical poison or snake bite also. So this is the role in which Chikitsa gold. In Charaka Chikitsa Sthana, Acharya Charaka has given a beautiful example that when we take a lotus leaf, you put the drop of water on lotus leaf, it won't hold even 1 second because it will slip down. In the same way, the body which consumes Suvarna on daily basis, poison will not affect him. In the same way, how lotus leaf will not hold a drop of water even for 1 second. 1 second. So same Charaka says, Tamra Bhasma mixed with honey shall be administered first for the Hriday Shodhan, and he should be then administered with a Shana Matra of Suvarna Bhasma. Important to note here that Acharya Charaka has advised 3 gram of Suvarna Bhasma, single dose, straight dose. This is for poison, to detoxify. Suvarna Bhasma quickly destroy all poison, even Garvisha. We will see what is Garvisha in next slide. And as I told you last, just as water fall on lotus leaves cannot wet it, Visha cannot destroy a person who is administered with Suvarna Bhasma. So beautiful correlation Acharya Charaka and also in Ashtanga Hridaya Bhagvat also have given the same example. Suvarna, those body who consume Suvarna for longer duration, no poison can harm that body. In the similar way, lotus leaf cannot hold a drop of water even for 2 seconds. It will slip off. In the same way, poison will eliminate from the body without giving any bad effect. Okay, so Charaka has told Hriday Shodhana. For Hriday Shodhana, we have to use Tamra Bhasma and Suvarna Bhasma. So in Ayurveda, according to me, every theory and every concept mentioned in Ayurveda can be seen as a broad level and micro level. I mean macro level and micro level. If we see Hriday as a macro level, we may take as heart or we may take it as a brain. On the other way, if we think this micro level, means Hriday means, or you may take this nucleus, you may take as a mitochondria, or you may take energy, this powerhouse of the cell. So this is the yukti we need to apply in our Shastra. Hriday means, okay, we understand, simply translate if Hriday is heart or brain. But in Sukshma, my micro thinking if we do means Hriday can be taken as a cell or nucleus of the cell. So Hriday Shodhan, what Charaka refers is, according to me, it is the cell inflammatory enzyme in the cell. To remove the inflammatory enzyme from the cell, we must use the gold. That is what Charaka and Ashtang Hridaya told. Now, question must arise that why Tamra Bhasma is only mentioned with the Suvarna Bhasma for cellular detoxification. Why not Rajat Bhasma? Why not Parat Bhasma? Why not Gandhak Bhasma and everything? So if we read Rasa Ratna of Samuchya, a beautiful quality of Tamra Bhasma is being mentioned. Tamra Bhasma has a guna of Urdhva Parishodhanam. Anything which you take, it will either induce a vamana or it will induce the virechana. Simple. Madan Phala you are taking means you will get a vomiting. Tivrut we are taking means it will cause the loose motion or purgative effect. But Tamra Bhasma is such a wonderful Bhasma that it does Ubhaya Parishodhanam. Urdhva Parishodhanam means single Tamra Bhasma intake will lead to vamana also and Virechana also. Another interesting point here is after consuming Tamra Bhasma, we will not see the vomiting and loose motion by our naked eyes. It is what Rasatna Samuchaya is talking about cellular level. Understood? When we take a Madan Phala, we get vomiting. We can see person is doing vomiting. We can see Trivrut after giving Trivrut, person is getting loose motion. But after giving Tamra Bhasma, we don't see any vomiting or any loose motion. But at the cellular level, vomiting and loose motion is happening. This is the important point when we are using Tamra Bhasma. This should be kept in mind. At cellular level, vomiting and loose motion is happening at cellular level when we are using Tamra Bhasma, and so on. Acharya Charaka has explained Tamra Bhasma has to be given first and then Suvarna Bhasma has to be given to remove the bad effect of the toxin in the body. Same Ashtanga Hridaya Bhagvat also mentioned the same example. The one who always consumes Suvarna Bhasma or gold salt or gold nanoparticle doesn't have the effect of Visha in his body, as similar as water doesn't touch the lotus leaf. Simple. So here we can see, all know that lotus leaf floats on the water, but if you put single drop of water and just move the leaf means it will slip off. So beautifully, when a person is consuming gold or Suvarna Bhasma or any Suvarna preparation, the poisonous effect will not happen to their body. Same way, water can't hold on this lotus leaf. Okay, so in first slide we show why should we use Suvarna. In that we saw that after giving all the Panchkarma, all the Saman Ausadi, if we are not able to see the significant improvement, then we have to use Suvarna. Another point why what Rachendra Chudamani says that what are area of work of Suvarna. So it will work for two main issues, Bhavi Rog Bandhan and second one is Prayovish. Bhavi Rog Bandhan is also, I think Suvarna is also one drugs that has the this quality of Bhavi Rog Bandhan. Bhavi Rog Bandhan means it will not allow your body, it will not allow the disease to manifest in the body. For example, let's take some genetic disease. Let's take cancer. For example, mother is having ovarian cancer or this cervical cancer. Chances are high that her daughter also may get this disease. But that in future, mother is having this future in the daughter also may get same cancer, breast cancer maybe in the future. We know that patient has a past history of cancer or any other disease, diabetes or any disease you take which is genetically can transfer from this child. So when we give Suvarna to those child, in that the genetic disease happening chances are very much high. When we give Suvarna, it will not allow disease to manifest in future. That is the Bhavi Rog Bandhan. I don't think any other Dravya in Ayurveda has this quality. If a Suvarna is patient is continue taking Suvarna, then future disease will not happen in that body. So we can understand with this genetically disease example. Mother is having breast cancer or this cervical or this cancer. Chances are high. We all know that daughter also might have in future. So better we give this daughter low dose of Suvarna Bhasma for certain time so that we can do Bhavi Rog Bandhan. It's very simple. Another second main is Visha. As I told you, my focus will be on Visha because Suvarna has main role to play in Vish Chikitsa. In Visha, we all know three types: Sthavar Vish, Jangam Vish, and Kutrim Vish. Sthavar Vish is mineral and plant-based poison, right? Jangam Vish is animal origin poison, snake bite, scorpion bite. Kutrim Vish is artificially means man-made poison. What we are consuming 24 hours daily in this 21st century. So all our body is contaminated with Kutrim Visha. Let it be water, you take a food. Even one more things I would add to here that here Kutrim Visha is artificial man-made poison means even Ayurvedic medicine are also coming with Kutrim Visha, which is sodium benzoate we are using as preservative. For coloring agent for tablet, the company had this titanium dioxide. So when person is taking any Ayurvedic medicine for 2 years continuously, which has a preservative and titanium dioxide or other this of molecule for coloring agent, this might also act as Kutrim Visha. Because in our Shastra or in our Samhita, no Charaka, Susruta, Vagbata has never written that you should add something to make the shelf life of drugs very long. So this is completely opposite to Shastra. But this is 21st century. We don't have time to prepare all the medicine. But at least we should try to give medicine which is self-prepared, or we should procure medicine from the person who is preparing without adding any preservative or coloring agent. So this is the main point we should keep in mind. Okay, we all know Garvisha and Dushivisha. Okay, so what is the Garvisha? Putrimam Gara Sanyam to create a Vivida Ushade, Anti Yoga Avaneshasu, Chirat Tat Pandu Udara Unmada, Durna Madinam Karut. Here last words of first line which says Vivida Ushade. Mixing different medicine becomes the artificial poison. Such poison kills immediately or slow death. It's Charaka also says the same thing, and Vagbata in Uttarasthana also says some same thing. We must keep in mind that this Vivid Aushade, mixing of different medicine can become poison. Let it be Ayurvedic medicine also. There is a one concept called Viruddhahara, we all know. But there is another things which we don't focus more in, which we should not mix some class of medicine which may act as a poison. Understood. Such poison kills immediately or slow death. When slow death, it is called Dushivisha. What are the symptoms of this Garvisha? We have person can have Sofa, Pandu, Udara, Unmada, and Arshas. Sofa is inflammatory response. Pandu is anemia, Udar is ascites, Unmada is psychiatric disorder, Arshas is hemorrhoid. As I told you, Kutrim Visha we all are consuming 24/7 nowadays all over the world. Nobody is left. In that we see SOFA is inflammation. So majority of the disease in 21st century has somehow inflammatory pathology developing at the cellular level. That be autoimmune disorder or any disease. Inflammation in modern science, inflammation of the any cell or tissue leads to majority of the disease. So this might be the disease caused by Visha. For example, if patient is coming to us with loose motion, we simply see Atisara or Grahani, but our mind won't go to the Visha Chikitsa. That we need to act on. So we will get a good results. Loose motion and diarrhea, how Visha Chikitsa is there, we will discuss in later on slides. Okay, liver failure is this Yakruto Udar or Dushi Udar also. 8 types of Udar Roga is been explained in our Shastra. In that one is Dushi Udar. Ashtanga I explained. तेन पांडु पुरुषो अल्पा अग्नि काच श्वास ज्वरा अर्दित वायुना प्रतिलोक स्वप्न चिंता अपरा श्लोक I won't go in detail. Okay. Dushi Vish. After becoming Jirna and due to the use of Vishnasak Dravya, Vish become weak in action inside our body. Due to this, it cannot kill person immediately. It stay in the body in the form of cough avrut. It will be avran. It will be covered by the cough for years, but it won't give major symptoms. It will give mild lakshana. How we can see this in practical life? So children, we see modern times after 3-4 years, children are eating this wafer, kurkure, dairy milk, and this fast food and everything. It all has this coloring agent and non-permitted everything, sweetening agent, everything. Once if today evening patient is taking such thing, means it doesn't mean tomorrow he will have symptoms or she will have the symptoms. It will act like a dushi visha. It won't cause any immediate action, but it will be slow slipping in nature because it will be cough avruta. Once it gets the proper atmosphere in the body, it will do bomb blast. I mean, it will create such a means a big disease. We see many, for example, 30-year male patient coming to us. He don't have any habit of any alcohol or smoking. He is taking regular normal food without means outside food he is not taking. But suddenly he developed the lung cancer. He is not smoking. He is not drinking. He is taking sattvic food. He is following all the dincharya, rutucharya. But how he got lung cancer if he doesn't have anything? So here comes the roles of Visha, as I told, inflammatory response. But the person, what he food or what vegetables or what fruits he is consuming, that is coming from pesticide use in the farm. So this is the role of Dushi Visha. What are the symptoms of Dushi Visha? Atisar, diarrhea, Kantihin Purush, lack of skin luster and glow. Rakta Dushti means blood disorder, we can see. Krishna, Aruchi, Murcha and woman. Thirst, anorexia, unconsciousness and vomiting. Vak dosha, speech problem. See, here Dushivisha Lakshana came as a speech problem, slurred speech or any other speech disorder. In second slide, I told you that in Rasajal Nidhi, this Vak Shuddhikar, the Suvarna helps in Vak Shuddhi, means purification of speech. I mean the slurred speech or Muk, Munmin or Gadgad. These three diseases for speech disorder is given in Sushruta Samhita. So again, this proves that Suvarna is pakka to be used for Vish Chikitsa. Because in Dushivisha also Vak dosh here again coming. And in Ras Jal Nidhi also Suvarna has a big role to play in Vak Shuddhi. Another is Dushi Udar or Sannipat Udar. As I told you, Dushi Udar is mentioned as one among the 8 types of Udar Roga, ascites and liver disorder with imbalance of all the three dosha. Here we see any disease, ultimate target organ in end stage will be liver. Either patient will die with liver failure or renal failure. So all the disease converting into the Udara Roga can be treated as Vish Chikitsa and we get the good results. Case from Patana means alopecia totalis or areata. There is also one important point is whenever patient come to us in OPD with a hair fall or alopecia, we simply give Bhungraj or we give some shampoo and hair oil. That will not going to work because we are seeing all doctors are using this Bhrungaraja and Nile Bhrungadi hair oil. No doubt, they have the role. But when patient is doesn't consuming any Viruddhahara, patient is taking a normal diet and still he is having hair fall from the body. Let it be eyelashes, hair, this hair, mustache and beard. In that, this patient we have to adopt a Vish Chikitsa in alopecia totalis and alopecia areata also. We must, all doctor must try this case from Patarna treatment with Dushi Vish. We will get a good result. Another important lakshana of Dushi Visha is Angadhvas, collapse or spasticity of organ, limbs or muscle, or it may fall. Maybe you may take as a necrosis, non-healing wound, diabetic gangrene. That also we can take in Angadhvasta. That is also Vish. Vish means here due to septicemia. Okay. Why it is called Dushivisha? It gets further Dushit by following factor. It will be in silent sleeping position in the body. When it will act, when there is a cold air in the atmosphere, when person is having ajirna or indigestion, when there is a cloudy weather, when person is sleeping in daytime, or he is doing Vishamasana, Adhyasana, everything, or Ahitkara Ahar Sevana. So at that time, some disease will show it Lakshana. So in practice, we may see that progress of some disease increase in the rainy season only. There we have to use Suvarna. Which disease? We see Amvad. If we see rheumatoid arthritis patient or arthritis patient, whenever there is a cloudy weather, when patient is sleeping, when they have indigestion, suddenly joint stiffness and joint pain will increase. We all have experienced this thing. The sudden when 2 days cloudy weather is there means patient morning will come. Oh sir, joint stiffness is increased since this 2 days. So this is the Dushi. It is like sleeping position in body, but when this factor it will come across this factor, it will show its symptom. Okay, so basic of Suvarna I have finished. Now we will take 3 to 4 classical medicine which contains Suvarna and we will see how actually it works in the body. First medicine is Bruhat Chintamani Ras. It contains Suvarna Bhasma, Ropya Bhasma, Abrak Bhasma, Log Bhasma and Praval Bhasma and Moti Bhasma. Okay, so this is the in Ayurveda we see very few medicine is being told which acts on Vata and Pitta together. Because if you are giving medicine for Vayu, it will increase Pitta. If you are giving otherwise, if you give medicine for Pitta, Vayu will increase because Vayu has a Shit Guna and Pitta has Ushna Guna. So this is opposite. Very few medicine can be given in Vata Pitta disorder together. We all know Vayu is a Shita, so we will give Ushna medicine to subside the Vayu. But on this side, Pitta will increase because we are giving Ushna medicine. For Pitta, if you are giving Shit medicine, here Vayu will increase. In that case, we have to use Bruhatva Chintamani Ras as it is told as Vata Pitta Rognashan. Vata Rog Pitta Krut Nihanti. how to understand how Bruhatva Chintamani works. In Charak Sutrasthana 12th chapter, Acharya Charaka has explained the qualities of the Vayu. The two main qualities we must understand is one is unavasthit and asangat. Vata dosha is unavasthit. Unavasthit means it will not stay at one place at each second. This time it is here, after 1 second it will pass here, after 1 second it will be somewhere else. So that is the unavasthit. It won't be stable in the body 24 into 7 since birth to our death. Vayu will not be stable in our body. That is the normal quality of Vayu. That is unavasthit. It won't be avasthit. Another major quality of Vayu is asangat, amurtarup. Amurtarup, asangat means we cannot see by our eyes, we have to feel by its action. So what is if we compare to these two quality in modern science means what is this? The Vayu which is anavasthitva and the Vayu which is asangat. That is the nerve impulse. When the nerve signal is passing through the neurons, it will be in electrical impulse, then chemical impulse at the synapses, and then again this chemical signal, then electric signal. So this is the Vayu. Whatever wherever nerve impulses is traveling all over the body, that is nothing but Vayu, because Charaka has told that Vayu is anavasthit and asangat. Another thing, Vayu is being told as Sarva Indriyana Mudyojak. All the sensory function in our body is is governed by Vayu dosha, means normal Vayu dosha. When Vayu is in its normal quality, it will do all the sensory function, and we all know sensory function is directly related to the nervous system. So Bruhatva Chintamani here proves that in all the neurological disease we have to use Bruhatva Chintamani Ras. Let it be neurological, neurodegenerative, or wherever the nerve cell or nerves are involved in any pathology, we have to use Bruhatva Chintamani Ras. Okay, where I told that in brain or nervous system related or nerve related, we have to use Bruhatva Chintamani. We all know central nervous system and peripheral nervous system. Whenever there is a pathology in the parts of brain inside the skull, cerebrum or cerebellum or any other part of the brain, let it be stroke, hematoma, tumor, anything. So in that, with Bruhatva Chintamani Ras or directly with Suvarna Bhasma, we have to use Panchamrut Loh Gugulu tablet. So this Panchamrut Loh Gugulu is given in a Bhaishajya Ratnavali Mashtishka Rog Adhikar. Mashtishka Rog means brain tissue. Wherever we find any pathology in the grey matter or white matter or simply broad, let's take it a broad concept, brain tissue, we have to use this Panchamrut Loh Gugulu. From my clinical experience, wherever we see the raised intracranial pressure, for example, meningitis is there, space occupying lesion is there, tumor, benign, malignant, anywhere where the ICP is raised, I have found that Dhandanyadi Kwath reduce the intracranial pressure very significant. Within a second or third day, patient feel significant reduction in the severe headache in case of this space occupying lesion, meningitis, everything. Suvarna Parpati Ras. If Suvarna Parpati Ras. So I told you diarrhea and loose motion which get me directly come to the Atisha Chikitsa or Grahani Chikitsa. Okay, no problem. We may follow that treatment. But patient coming with 10 to 15 types of times diarrhea in single day, after trying all the classical this Atisha Chikitsa and Grahani Chikitsa, we are not able to control the motion of the patient. That time we have to focus on Vish Chikitsa. How this happen? Let's see. Whenever person is taking contaminated food with either bacteria, virus or fungus, it will release the specific toxins in the intestine, that bacteria. So that toxins will leads to the inflammatory changes in the gut flora or the intestinal wall. So this will lead to food poisoning and other similar illness. So in this condition, we have to use Suvarna Parpati. First, I have told you Bruhatva Chintamani where to be used. Now is Suvarna Parpati. In such condition, wherever we see the inflammatory response in the lower GIT or GIT, we have to use Suvarna Parpati. For example, Crohn's disease, ulcerative colitis, inflammatory bowel disease, toxicity in the intestine, cancer in abdominal organ, or secondary metastasis to abdominal organ or peritoneal cavity. We see Dushi Visha has one symptoms called Shwasa, inflammation, that we discussed in the previous slide. You see all the disease of this autoimmune disease, this ulcerative colitis, Crohn's disease, this IBD, everything has inflammation as the main pathology in this gut flora. So there we have to use Suvarna Parpati. Then Kumara Kalyan Ras, exclusive preparation for children or pediatric practice. Before going to the Kumar Kalyanas, there is a concept called Graha Dosha in Ayurveda. If we read the Kashyap Samhita, which is exclusively pediatric book, where disease, symptoms, everything about children has been explained very beautifully in the Kashyap Samhita. There, Acharya Kashyapa has mentioned numbers of types of Graha Dosha which can affect the newborn baby or baby, maybe 8 to 10 years age. So in that, we have to see the patient as whether this child is affected with a graha dosha or not. The 2-year baby boy is coming to us. Mother is complaining that since 15 days this baby is suffering from fever. We have tried all the antibiotic, we have done everything, culture sensitivity report we have done. Based on that only we have given antibiotic and paracetamol, everything, but still fever is not in control, unknown origin of fever. So such case can be visualized in terms of graha dosha in the children. A beautiful sentence is written in Ashtang Sangraha that Vishantasya Lakshante Kevalam Shastra Chakshusha. The Graha Dosha we cannot see by naked eyes, but we need Shastra Chakshu. Here, Shastra Chakshu means the Vaidya who has read whole Kashyap Samhita and he has understood whole the Kashyap Samhita, then only that Vaidya can see the Graha Dosha in their patient. So beautiful Ashtanga Sangraha has written that we must read Samhita properly, we must understand it, then only we can able to see Graha Dosha in the children. It is not like that I am saying in this seminar webinar and tomorrow we see the Graha Dosha in patient. No, we need to read the Samhita, we need to understand Samhita properly, and then only we can see Graha Dosha in the this pediatric patient. So this is exclusive medicine for Graha Dosha, first priority for Kumar Kalyan. And in other indication is fever, cough, vomiting, psychiatric disorder, lactation difficulty, jaundice, infective liver disorder, dysentery, diarrhea, or digestive disorder. All these diseases can be fit in a Dusivish or Garvish because the mother is taking milk from where? Either she is consuming from dairy milk, means packaged milk, or she is consuming milk from cow or buffalo which are being injected with oxytocin injection, or being feeding grass with a pesticide. So this which will pass to the baby anyhow. So in the what I mean is we need to see we need to see which role of Visha in all the patient. All the patient visiting our OPD in 21st century, we must see the role of Visha. Okay, so Ashwagraha and Vichaka, these are the two Graha doshas I have shown here. There is a 16 or 18 types, I think, the Graha dosha mentioned in this Kashyap Samhita. So Kumar Kalyan can be given with this following other Anupana. Maybe can be given it with Vacha Churna, Ranjanyadi Churna. This is all familiar. Saraswata Churna, Go Grit, butter, Hemvati, Vacha Churna, etc. If with convulsion, because in pediatric epilepsy and this convulsion is more, in that we use Kumar Kalyan Ras with Vatkulanta Ras. That gives the into very good result. Shri Jaimangal Ras. Which is very minimum formulation, which are indicated for Dhatugat Jwara. We have read in Charak Chikitsa, Jwar Chikitsa that Ras Dhatugat Jwar, Mas Dhatugat Jwar. But very in that Charak Chikitsa, they have explained medicine. No doubt. But single formulation for Dhatugat Jwara is this is Sri Jaimangal Ras. This is beautiful formulation to be used in critical patient because Jwara is reaching to the Med Dhatu, Mas Dhatu, Asthi Dhatu and Shukra Dhatu. Till the Jwara is reaching Shukra Dhatu means patient is about to die. His death is very near. In that case, we have to use Jaimangal Ras. Let's see practically how we can use. I have to Shukra Dhatu Gat Jwara is there means we have to use this Sri Jaimangal Ras. We Charaka says Shukra Sthan Gata Shukra Moksham Krutva Vinascha Pranam Vayu Agni Somascha Sa Ardha Gachati So Vibhu. So when Vayu, Agni and Soma, these three leaves the body means person is dead. We all know that once Agni is getting diminished 100%, person is dead. Another death definition in Ayurveda is when Vayu, Agni and Soma. Agni it comes here. When these three material when leaves the body means person is dead. Vayu means we have told it is asangat and amurtarup and anavasthit means this is sensory function. Vayu, let's take. Agni means we may take metabolism and everything. Here Soma is we have to use Yukti and we have to understand what Soma can be in individual patient. Maybe immunity, maybe this Ojas. Anybody means with our Yukti we have to think what Soma can be taken in individual patient. So in this such patient we have to use the Shri Jaimangala. So where we can see Vayu Agni and Soma is leaving the body means death is very near for the patient. So such kind of patient we see in the ICU. Those patients are super critical patient and they have fever of unknown cause of origin. So that might be the Shukra Dhatugat Jwara. And if we use Shri Jaimangal Ras with proper modern intervention, because in ICU means patient will be on a ventilator or machinery support. So we have to give Shri Jaimangal Rasa. Chances are very much high that we may get very good recovery in such cases if Shri Jaimangal Ras is being given to the patient in this condition. We are using this Sri Jaimangal Ras in many critical care patient. In COVID also we have used H1N1 in some patient we use this Guillain-Barré syndrome also we have used. So we get very good result. Another aspect how we can understand Shukra Dhatu Jwara. If we see third and fourth stage of cancer, multiple organ metastasis, more than 4-5 organ is affected with cancer means a patient is about to die within few days. It means Vayu, Agni and Soma are ready to leave the body means person, this can be understood. This is my yukti based on what I understood by reading these things. I have write this. It doesn't mean all should agree with this, but what I understood and what I felt with results of medicine, I have concluded that Shukra Dhatu Jwara can be taken as third and fourth stage of cancer or multiple organ metastasis. So in that also we can use a Sri Jaimangal Ras. So when Vayu and Agni and Soma leaves the body, we should use Sri Jaimangal Ras. You see all the multiple organ metastasis. For example, kidney cancer is there means it will go to pancreas, it may go to lung cancer, bladder. So in this patient, we must use Sri Jaimangal Ras. And of course, fever will be there. The main indication Jaimangal Ras is Jwar. What? In Dhatugat Jwar, and Dhatu, Utthan, Gambhir Dhatugat Jwar. That we talk about Shukra Dhatugat Jwar. Now we talk Majja Dhatugat Jwar. What happened when Jwara is reaching to the Majja Dhatu? Hika, Swas, Tatha, Kas, Tamat, Sardi, Ati Darshanam, Marmat Chedo, Bahi Shaityam, Daho, Antasya, Majjage. So when fever is going to till the Majja Dhatu, then patient will see tamas, ati darshanam of tamas. Tamas ati darshan means feeling of entering into the darkness frequently. If you observe the ICU patient, those who are in ICU, without giving sedative medicine, patient will be sleeping 24 hours. There is no sedative orally or intravenous medicine is going, but still patient is sleeping 24 hours. It will be drowsy. There is no sedative going, but still the effect of sedation is there. It is nothing but tamas ati darshan. Then marmat ched. Marmat ched, simple vital organ failure, liver failure, kidney failure, heart failure. Patient is going to die. That is the Majjagat Jwara. So tamas ati darshan and marmat ched. Feeling of entering into the darkness. That is the drowsiness or sedation without induce means without giving medicine, patient is in sedation. That is the tamas ati darshan. And marmat ched means vital organ failure. All these patients will be very common in ICU. Such case we have to use Sri Jaimangal Ras. Majja Dhatugat Jwar and Shukra Dhatugat Jwar. I have explained how we can practically see this is Majja Dhatugat or Shukra Dhatugat Jwar in patient. We have to use Sri Jaimangal Ras with our appropriate Anupana and dose. Rasendra Chudamani book is there. In that Anupan wise diseases explained. For example, if we want to treat Vata Jwara, then it can be given with Rasa Sindur. Pitta Jwara, Suvarna Bhasma can be given with Rasa Sindur also. Kapha Jwara, same Rasa Sindur. If there is a G, we have to give Suvarna Bhasma with Abrak Bhasma and honey. Jeerna Sangrahani, let it take set ulcerative colitis or IBS. Then we have to give Suvarna Bhasma with Ras Parpati. Nava and Jeerna Pandu. All the jaundice or Kamala condition we have to give with Abrak Bhasma and Low Bhasma. Rajyasma is there means with Abrak Bhasma. Garbhashay Shuddhi important to note that Garbhashay Shuddhi. In nowadays, majority of the couple are not able to conceive. Either male has some problem or female has some problem. PCOD is there, fibroid is there. So Garbhashay Shuddhi words has been written in Rasendra Chudamani. In such cases, with chok chini churna or kshir kakuli powder, we have to give Suvarna Bhasma to detoxify the uterus. Detoxifying the uterus. Jeerna Firang is a sexually transmitted disease, syphilis, which can be taken in such a disease. We have to use Swarna Bhasma with Rakta Shodhak Dravya or Rasa Pushpa. Daru Swas Rog, pulmonary, this chronic pulmonary disease, we can use with Shati Churna. Jeerna and Navin Amlapit, we have to use with Amlaki Churna. Apasmar, we have to use with Rasa Sindur, Shankh Pushpi Churna, or can be used with Vat Kulantak Ras, as I have told. Stirokampa, Parkinson, Alzheimer, we have to use with Balakwat. Mushak Soth, bottom swelling, in that we have to use Kanjali and Punarnava with Suvarna Bhasma. To gain the beauty, we have to use this Suvarna Bhasma with Rakta Shodhak Dravya, means the herbs which are having quality of blood cleansing quality. For example, Rakta Chandan is there, Kesar is there, Kamal Kesar is there. For schizophrenia, we have to use with Shunthi, Loving, Marich, black pepper and like that honey. When Mrityu Arishta Lakshana is there, that sign we are observing, then we have to use Suvarna Bhasma with Amlaki Soda, Bhavana and Khadik Tokpat. What we have told in Shri Jaimangala Ras, when Vayu, Agni and Som are about to leave the body, this is Mrityu Arish Lakshana. That by experience, seeing patient and patient, then we can able to see this death signs. This is difficult, but to practice we develop this. For intelligent, we all know Vata Guruchi, Shunthi Shatavari. To improve again infertility, Shalparni, Vidarikan, Ashwagandha, Kapikachu is there. To get the youthfulness or to maintain the youthfulness with Amlaki, Shalparni, Shunthi to be given. In initial slide, I have told that the person who consumes Suvarna Bhasma for 20 years, gold consuming for 20 years, he will be youth throughout the age. Jivani effect to increase the Garbhadharan Shakti. Here also, to increase the Garbhadharan Shakti, to increase the power of this uterus, to give the best bed for the fetus for 9 days. We have to use 9 months. We have to use Nag Kesar Churn. Stanya Shuddhi or Vruddhi lactation, we have to use Kakulyadi Varga Dravya. For Vish Bada, we have to use Swarna Makshik Bhasma or Sharkara. Hiccup is there, means Patal Phal or Madhu. Asthi Shos or Asthi Shotata, bone tissue inflammation means with Suvarna Bhasma, we have to use Sharkara. Garbhashay Shot, inflammation of the uterus, we have to use with Shilajatu, Loho Bhasma. Mushak Shot, again for scrotal swelling, turmeric haridra. See, many swelling comes in this 3 slides. Uterine swelling, Asthi Shot, this Mushak Shot, Garbhashay Shot. As I have already told you, Shotha is one among the cardinal feature of Dushi Vish. I also told you that majority of the disease in present times have the inflammatory response being generated at the cellular level. So use of gold is must. So again it is proving that our Acharya were 100% right. What they have written is their thousands of years of experience on human beings and they have written. Last one is Rasraj Ras. So these both are working on nervous system, but what we, if you want to differentiate where to use Bruhat, Vata, Chintamani Ras and where to use Rasraj Ras, when there is a pathology in central nervous system or a disease related to central nervous system, we have to use Bruhat, Vata, Chintamani Ras. When there is a peripheral nervous system involvement in any disease, we have to use Rasraj Ras. Swashkas, Chintamani Ras, we all use in COVID. All Ayurvedic doctor, all the patients, those who recovered from this ICU or ventilator, this is due to Swashkas Chintamani Ras. This we will see how COVID patient recovered by gold. There is a modern evidence also. We will see next. Chintamani can be used as chronic and life-threatening disease of Pranava, Srotas Vyadhi or respiratory tract. Let it be upper respiratory or lower respiratory. Tumors of lung, adenocarcinoma is there, or secondary metastasis to lungs, malignant effusion, pleural effusion is there. Lung fibrosis or interstitial lung disease is there. Latest we adding COVID-19 and H1N1, and also to prevent the secondary metastasis to lungs, post-COVID lungs weakness. Majority of the oral cancer has the metastasis to lung, either malignant or pleural effusion. It will start. We may use low dose of Suvarna Bhasma in oral cancer to prevent the secondary metastasis to lungs. Okay, to enhance this effect of Suvarna in this Pranava Srotas, we have to give Pushkar Mul Siddha Jal or Dashmul Siddha Jal. Means we have to prepare a medicated water either from Pushkar Mul Churna or Dashmul Churna. In Swast Chikitsa, even Acharya Charaka has told that the person who is having this tas or swas, he is not allowed to drink normal water. He must take Pushkar Mul Siddha Jal or Dasmul Siddha Jal. In COVID also, I have used Pushkar Mul Siddha Jal in all the patient. There is a Bilwa Phala is to be contraindicated while consuming the Suvarna. Bina Bilwa Phalam atra sarva manyate prasasyate. Rasendra Chudamani says that this Bilwa fruit is contraindicated while giving the Suvarna Bhasma. The reason behind this, I still didn't understood why this author Rasendra Chudamani Acharya has told that this Bilwa is to be contraindicated in this Suvarna Kalpa. But we have to accept. It is written in our Samhita and Shastra. We have to accept. We should not give Bilwa Phal. Here is Bilwa Phal. Bilwa Patra Swaras or any Bilwa bar can be given. Bilwa Phal should be contraindicated in Suvarna Bhasma Sevan. Now we see Atisar or Grahani, loose motion, irritable bowel disorder or this ulcerative colitis. We give plenty of Bilwa preparation. Along with that, we also give gold. So we have to be careful that in such condition, whenever we are using Bilwa, we should not use Suvarna, or when we are giving Suvarna, we should not give Bilwa Phala to the patient. This is okay. So again, one question must arise that how much gold, salt of gold, this should be given to person. So Rastarangani says fourth to eighth part of one riti should be the usual dose. That is 15 to 31 mg approximately. Physician has the full freedom to decide the dose of any medicine by seeing his patient. This is the normal usual dose. Okay, so it's a Suvarna preparation. I use Dhoot Paveshwar company only because since beginning I am using Dhoot Paveshwar company's Suvarna preparation and I haven't seen any side effect and I have got very good result. So I have taken their reference here. So Suvarna Bhasma Matra in famous classical preparation. We must know we are using Swaskash Chintamani, Bruhatva Chintamani Ras, Suvarna Parpati, everything we are using. But we must know that how much gold is there in single tablet. So in Dhoot Papeshwar, there is two kind of product is there. One is premium quality and another one is a standard quality. So the premium quality of Bruhatva Chintamani Ras contains 7.5 mg of gold. Suvarna Parpati contains 31.25 mg. Jaimangala Ras contains 10.46 mg. Kumara Kalyan Ras contains 10.41 mg. Rasraj Ras contains 4 and Swaska Chintamani 5. The standard contains double of this premium dose, but standard this medicine is cheap and premium is costly. Now again question must arise. Bruhatva Chintamani standard contain 15 mg, but it is available in cheaper rate. But Bruhatva Chintamani premium contain only 7.5 mg, but it is double of that cost. So why it is like that? Let's see. The premium Suvarna Kalpa which Dhoot Papeshwar prepare, preparing from the reference taken from Bharat Bheshaj Ratnakar 5th volume 8357th sloka. Shodhana Vidhi is there, purification method. If we do purification method by this reference, elemental gold will be 95 to 96%. That is premium Suvarna Kalpa of Dhoot Papeshwar. So the rate is double to compare of standard. But gold is standard Suvarna Kalpa. Shodhana is being done from Rasa Tarangini reference 15th chapter and elemental gold is approximately 18 to 20%. So the rate of standard is less. Suvarna premium is costly. Suvarna Lavana is nothing but gold salt, which modern science is talking nowadays. This we have reference in Rasendra Rasa Tarangini. Suvarna Lavana Matra. Suvarna Lavana here is gold salt. We all know that in rheumatoid arthritis, disease modifying anti-rheumatic drug factor, they give a drug directly in knee joint injection, gold salt. So this is nothing but our Suvarna Lavana. So the dose of Suvarna Lavana is 2.5 mg to 6.25 mg. Again, reference from Rastarangi. One study has been done, Cisplatin versus our gold salt. That is AuCl2, Suvarna Lavana. Cisplatin, we all know that is the chemotherapy medication used in majority of the cancer. Let it be tubercular cancer, ovarian, cervical, breast cancer, bladder cancer, head and neck cancer, esophageal cancer, lung cancer, brain tumor and neuroblastoma. It is given by the injection in the vein. So majority of the cancer, the modern science uses cisplatin as the chemotherapy agent. So one study has been done and comparison has been done with cisplatin and gold salt on the human cancer cell. Let's see. So IC50 is inhibitory concentration 50. In first row we see SW620, SW1116, SW403 and all. That is the human cancer cell, tumor cell. In vivo study has been done. You see AuCl2 is our gold salt or Suvarna Lavana. PTCl2 NH32 is Cisplatin. See the colon HW620 types of tumor cell in colon needs only 50 inhibitory concentration for gold salt compared to cisplatin which requires 120 IC50 inhibitory concentration. The action of gold salt compared to cisplatin is higher in colon cell in this. So we can see very good results of gold particle gold salt compared to cisplatin. You see colon third row SW403, that is the tumor cell colon. In that to inhibit the 50% growth of the cell, the gold salt is required only 50 concentration, but at cisplatin required 200 IC50. You can imagine how beautiful this gold salt is working. Now, cytokine storm and Suvarna. Use of Suvarna is must in cytokine storm to prevent multi-organ failure. What Swasta Chintamani Ras acted on COVID patient and patient came out of ICU and became healthy. That is pakka due to this Suvarna preparation because it has a big role to play while cytokine storm is being developed in the body. Cytokine are the regulator to host response to infection, immune response, inflammation and trauma. Some cytokine acts as disease worse, whereas some others serve to reduce the or promote the healing. Attention also has focus on blocking cytokine which are harmful to the host, particularly during the overwhelming infection. Interleukin 1 and tumor necrosis factor, these are the main inflammatory cytokine can be seen in majority of the disease. In COVID-19, we have seen interleukin 6. And when they are administered to the human, they produce fewer inflammation, tissue destruction, and in some case, shock and death also. For more detail about this cytokine and use of gold in cytokine, you may go to the chest general volume issue. Everything is written here. Reducing the biological activity of IL-1, this is interleukin, and tumor necrosis factor is accomplished by several different but highly specific strategy which involve neutralizing the antibodies, soluble receptor and receptor antagonist, and inhibitor of the proteases that convert inactive prosecutor to active and mature molecule. Blocking of IL-1 or TNF, tumor necrosis factor, has been highly successful in patients with rheumatoid arthritis, inflammatory bowel disease. Rheumatoid arthritis is also Lucivis Lakshan Shwat inflammation, inflammatory bowel disease. So these are also this thing is also proven by modern science that gold is very good to reduce the inflammation or inflammatory enzyme. This is IL-1 and TNF. So this is the cytokine storm, how COVID patient died when this happened. Gold salt or gold nanoparticle inhibit the overproduction of inflammatory cytokine. Wherever we see the cytokines from any disease, closing eyes, we must use gold, Suvarna Bhasma, gold salt, or anything which contains gold. We all know how Suvarna Yoga has saved many critical patients of COVID-19 and H1N. Gold nanoparticle reduce the inflammation in the cerebral microvessel of mice with sepsis. This also research has been done. Detail is being given in the link. As we told, Suvarna has a best work on Bhuta Avesha. As I told, Bhuta Avesha means we can take it bacterial infection, fungal infection, viral or protozoal or septicemia. So what they have proven nowadays, which is already proven 3000 years back. Bhuta Avesha means this is our modern antibiotic. So use of Suvarna in patient where majority of the antibiotic are showing resistance. Antibiotic being a major weapon in the modern science is now struggling to manage or treat the infection with antibiotic due to its resistance. We have seen many patient, pediatric patient, their age is only 5 days or 10 days. They are getting fever. Physician, pediatrician will do the culture and sensitivity test. They have only 2 to 3 antibiotic which is sensitive to antibiotic. The child's age is only 5 or 10 days, but his body is totally resistant with all the antibiotics. So what to do in such case? If this child is getting more ill, no antibiotic will work. So use of Suvarna can be game changer in this field, and we must use this opportunity to help mankind and to popularize the Ayurveda globally. Again, I will say thousands of years of human observation and trial and error is far greater than and better than 6 months of rat experience in the lab. We must believe our own classical text, which is written based on thousands of years of experience, based on number of people's experiment, and then our Samhita is written. So we must start reading our Samhita on daily basis. That is the only way to become a successful Ayurveda practitioner.
They have a few questions that cytokine
Cytokine storm.
storm, sorry,
Yes.
is seen in sepsis as well, and COVID is said to mimic sepsis. So have you used, I know you used gold salt in COVID patients when Dr. Hebbar said that a lot of Ayurvedic doctors were drawn into treating COVID patients in ICU. Have you used this in sepsis as well?
Yes.
So when you use in sepsis, did you use that in the ICU?
Yes, we actually get a critical patient query more in the, because in our Surat city we have some physician who is coordinating with Ayurvedic treatment with modern medicine in critically ill patient.
So do you think a large number of allopathic doctors are now open to be using Ayurveda along with the mainstream medicine?
Yes.
In spite of providing evidences also, madam, I think if there is an egoism factor,
It will also play a role.
yeah, so definitely they will not be accepting, because all our sciences have their own way of see. The ultimate goal is healing, but we have different approaches. Ayurveda, maybe like Dr. Rajnikant rightly said, he has been very successful in treating these cases in ICU also. But again, if there is a goodwill between the Ayurveda doctor and the modern doctor, then probably they may collaborate to treat the patients. I think that is a healthy sign. If that goes on developing in future, collaborative work after seeing the results. But if the egoism keeps on playing the part, so if we keep it right on the top in comparison to the benefit of the patient, definitely it is not going to work. And question number 2, what you asked also was important. Modern doctors, whether they're using Ayurveda medicine, absolutely yes. Right from my graduation days. So it's been around 23 years after completion of my graduation. Since then, I've been seeing there are plenty of allopathy doctors, modern doctors, and other system doctors are also using Ayurveda medications so openly prescribing Ayurveda medications along with their medications. People don't question. So that is also there, and they might not. They too might not have complete knowledge. They will definitely not have complete knowledge about only the success clinical stories, what the pharmacies tell, and also the medical representatives tell, and how much incentives they're going to get. This all makes them to market the Ayurveda medication. So that's it. With improper knowledge, so allopathy medicines or doctors are also, not only allopathy doctors, other system doctors are also selling and marketing Ayurveda medicines.
Nowadays, people are using colloidal gold. Is that the same roughly rough effect in removing toxins? Can colloidal gold solutions be used like the Suvarna Bhasma in Ayurveda?
Gold in any form will detoxify the body at cellular level.
Yeah, just a little bit information on colloidal gold. Sometimes referred to as gold colloid is a suspension consisting of submicron gold nanoparticles suspended within a solvent, most often water, used in diagnostics and therapeutics. And because it is a microdosing of gold, it would have similar effect as Dr. Rajinikanth has clarified.
There is a paper published. It's actually a systematic review from in Cochrane database about the use of gold in rheumatoid arthritis. And I know you mentioned Dr. Rajnikant about that. But they talked about some adverse effects, including kidney damage and skin discoloration, etc. Does that happen with your medication?
No. I haven't seen any side effect due to this so-called heavy metals. We must use good company's medicine. That is what I have suggested.
And also the dose, applicability, right dose for right duration, classical Shastra knowledge, everything plays a role.
3 gram gold at a straight dose has been told by Charaka for Hriday Shuddhi. So might be in a myocardial infarction. This is the area of research. Let's give 3 gram of Suvarna Bhasma in myocardial infarction and see.
The paper that is published pertains to an use of it in allopathy, where they're injecting. So there they found the side effects. But I was wondering if based on what you're saying, there are no side effects with the Ayurvedic treatment.
A few points what he mentioned. like Bandhanam Bhavi Roganam. So that was wonderful point I felt. If we can use Swarna preparations and preparations like this, and if we can prevent the occurrence of diseases before they occur, or prevent the occurrence and recurrence, if we can prevent. As he was telling about the genetic disorders, so probably Dr. Rajnikant also will agree. This is applicable to all the diseases which have a genetic predisposition. There we can use it. And one such example, can we take it as Swarna Prashana, which is going on. If we can administer in a proper way and a reliable way.
Yes. So might be the reason for Kashyap Samhita or Kashyap Acharya said he actually may be focusing on Bhavi Rog Bandhana when he is talking about Suvarna Prashana. Looking at immunity, but what is thought, we have to use our yukti and we have to think.
Bandhanam Bhavi Roganam, wonderful word that is. And we also have a similar word called Bhavi Roga Bodhaka Lingam. Purva Rupa. So like Purva Rupa is defined as that which indicates a disease which is not yet formed. So like Purva Rupa is a stage, that is a fourth stage in Sushruta's Shatkriya Kala, where we diagnose the disease even before it is formed by looking at some signs and symptoms. Even if a doctor can find out any disease at the Purva Rupa stage, we can use Swarna Kalpas as Bandhanam Bhavi Roganam. So this is one concept I just wanted to contribute to your presentation. Recently, I was going through a chapter on Shita Pitta. So Shita Pitta also is due to the contact of cold air. There, Shita Maruta Samsparshat, where Acharya gives right at the beginning. So even I was also thinking in this perspective, just Shita Maruta Samsparsha is causing a disease called a Shita Pitta, which is having Bahir Visarpa and Antar Visarpa. The disease is spreading not only on the skin. We think that it is compared to urticaria, that this, and we are thinking it is only manifesting outside. It is also going inwards, and it is affecting multi-systems and multi-organs, and over a period of time, it can become a complicated disease. That is why it is explained after Kushta. And our Acharyas in Madhukosha Tika, it is given Shita Pitta has a similar picture of Kushta, like Tvak Dushti, and also the Tridosha involvement, just like Kushta. That is why Shita Pitta has been explained after Kushta. So we think Shita Pitta is a small disease. Udarda, Kota, these are small diseases. But when we go through this explanation of Dushi Visha, probably there was some Visha already in the body, and Shita Maruta Samsparsha will aggravate Vata and Kapha and cause this. And in diseases like Shita Pitta, where people are suffering as chronic diseases, no remedy at all, I think Swarna Kalpas mentioned by Dr. Rajnikant will come in handy, definitely. And coming to Bruhat Vata Chintamani Rasa, I had a question. At last you mentioned Dhanada Nayanadi Kwata, it should be used. So was it individual? Yeah, it was in the same slide. So I just wanted to know, is it with Bruhat Vata Chintamani you were mentioning?
Yes.
Okay, so that was it. So and other kalpas also were good. So like
individually also, wherever intracranial pressure arises, Dhandanyadi we can use.
In your clinical practice, the end stage organ failures or whatever, almost like Arishtalakshanas, also you touched when you mentioned the death point there, Vayu, Agni and Soma leaving the body. Okay. Have you tried to analyze that in any patients? Like how do you know that Vayu, Agni and Soma is leaving the body? That may be a metaphor, or that may be some analogy where we are using, but you said with experience, it comes with experience. Like, did you notice? Yeah, we can consider that Agni is coming down, total metabolic shutdown, body is getting cold, no digestion activities, not able to take the food. Vayu is, so if we take Vayu Yantra Tantra Daraha, so also you mentioned in terms of Indriyas and those things being managed by Indriyanam, Udvejaka, Indriyanam, Abhivoda, so many terms have been used in that particular sense. And Soma. So there is an imbalance of Vayu, Soma, Agni, these three factors which are maintaining. Have you in any critical patients tried to analyze, because you have used these words and mentioned death and with an arrow mark? Yeah.
I have told about two Dhatugat Jwara, Majja Dhatugat Jwara and Shukra Dhatugat Jwara. First I have covered Shukra, then Majja. In Majja Dhatugat Jwara, I have told Ati Tamas Darshanam. So majority of the patient, when we see in ICU, they will be drowsy. There is no sedation going in the medicine, but still patient is sleeping 24 hours. Such days it is passing means fever will go to Majja Dhatu, from Majja to Shukra Dhatu.
Right.
And we all know majority of the patient from ventilator or machinery support, mechanical ventilatory support, very few coming back. Maximum will die.
Yeah, my question was, Dr. Rajni, have you gone to the extent of writing on your case sheet Majja, Dhatu, Gata, Jwara, underlined or in bracket? Because see, as physicians, we don't go to that level of diagnosis through Ayurveda. So since you have mentioned in your slide, I just wanted to know, as a young enthusiast, you are reading so many books and you have a cumulative knowledge of so many granthas. I can understand that you are going through some books which even I haven't heard about. So that is really appreciable. So have you gone to the extent of diagnosing? Okay,
No,
no?
we initially don't had in my part to maintain the data and everything. After mucormycosis, yes, I have all the patients data in my this software, and now I have hospital. So now we are trying to generate more and more data.
See you in the
Thank you,
next session of Guru Bodha next
Namaste.
Sunday. Namaste.